from the Asian Community Development Council. This is Family in Focus, Mondays at 12 noon on PHLV Radio.
Hi, everyone. Welcome to Family in Focus. Great to have all of you with us today. On this Monday, we're going to focus on a topic that is, of course, near and dear to my heart, with the show being organized by the Asian Community Development Council, the importance of community health clinics. We want to talk about that today because, as some of you may already know, ACDC, this nonprofit that is based here in Las Vegas, is launching a new community health clinic this year, 2022. So that is the project for them, coming, of course, at the time that we really need a place like this, especially as we are still kind of hopefully now in the tail end of this pandemic, but it's still affecting so many people out there. And I have some great people joining me on the show today. We have Dr. Maria Urbis-Tondo. She is a director of Health Center with ACDC. She's going to be leading this health clinic once it opens later this year. We also have a new member of ACDC just joining us recently, Dr. Julia Oberndorf, and she's a clinical coordinator at ACDC. And also we have joining us Dr. Christina Madison. She is the founder of the Public Health Pharmacist. She's been a community collaborator with ACDC for quite a few years now, so she's very familiar with what we do here in this organization, especially when it comes to the efforts we're putting out there to keep our community, not just Asian American Pacific Islander, but just the whole community safe and in a more educated space when it comes to our health care. So glad to have all of you on the show with us today talking about this very important topic. So first of all, Dr. Maria, I'm going to bring you into this conversation first because we're talking about a community health clinic and why it's so important. And ACDC is launching this very kind of a big project, something that's never been done before with this organization, and you're going to be spearheading this. So Maria, tell us a little bit about what's in the works and when would you expect this clinic to open here in Las Vegas?
Tranya, thank you for having me here. It's really great to represent our upcoming medical center, and we are hoping to open that medical center sometime in 2022. And I think it's a wonderful project for us. Our mission for our, it's actually called HAPI, Happy Medical Center, and the Happy stands for Healthy Asian Pacific Islanders, because that is our core value, to promote healthy Asian Pacific Islanders with our medical center. Now, the mission for our medical center is to meet the healthcare needs of the API community by providing quality health services. At the same time, removing those critical language barriers that really pose an impediment for so many people from reaching out and communicating their needs to the healthcare, the staff, hospitals, and the community at large.
Yeah, and the healthcare aspect of what ACDC is doing is nothing new. And maybe, Julia, I'll bring you in here because you, even though you just joined ACDC recently, you've been part of our efforts, especially when it comes to the vaccination clinics, the COVID-19 vaccination clinics. I know you just took part in one this past weekend. So, Julia, talk to me about that, just because, we want to kind of expand, right, our effort of doing this. And just you being there at the vaccination clinic so far, we've been doing this for quite a while now. What was your reaction just seeing the community's needs and what we're giving back during these clinics?
Yeah, so this last Saturday was actually my second vaccine clinic with ACDC. It was pretty interesting. My first clinic, I was really surprised because we had a lot of, minorities showed up, a lot of Asian speaking patients showed up, and we had a team. Also, we had a lot of volunteers from Touro Medical School, a lot of translations. Many of patients didn't speak English. I speak fluently Vietnamese, so I actually helped a lot of Vietnamese speaking patients in obtaining their vaccinations. Honestly, I don't know how they would have just, got their vaccines at Albertsons or CVS because they don't know the language at all. It was definitely eye-opening. I never thought about it, that big of a deal about it until my first vaccine clinic. And yeah, my second one on Saturday, it went really great. We actually vaccinated a homeless guy as well. That was really eye-opening. I don't know if Dr. Maria wants to expand on that aspect.
Yeah, and it's interesting. And if people are listening and watching this and not know, ACDC has been kind of instrumental in reaching out to neighborhoods and being in that space where Asian American Pacific Islander live and work. And we have some pictures to show from this past weekend where I think Julia and Dr. Maria got all these balloons actually to let people know that this clinic was happening at Shanghai Plaza, even though it's been happening for a while. And Maria, you said that you actually had a homeless guy stopped in because he saw the balloons, right? Like what is happening, and he wanted to get help at this clinic.
So we were actually surprised, but yeah, very happy that a homeless gentleman came to our vaccine clinic, and he said, I want to get my COVID vaccine. And I asked him, well, sir, how did you hear about us? Like, how did you know about our clinic? And he said, you know what? I saw the balloons that were on your sign, and it made me feel really happy. And I thought, yeah, maybe I should get my COVID vaccine. It might be a good idea today. So he got up, he filled his paperwork. He, that we have a formatting to use for people who are, without a permanent address. And so we helped him fill out the paperwork, and he was able to get a Johnson & Johnson one-shot COVID vaccine. So he doesn't have to come back if he can't make it again for a booster. If he is traveling elsewhere or maybe not in the area, at least we know that he is protected at least 65% against the COVID virus. And it was just a phenomenal way to reach out, not just to the Asian community, but to our community in general, because we firmly believe that by protecting others, we protect ourselves. The COVID virus is now passed along primarily by people who are unvaccinated. And so it is important to vaccinate as many people as we can, even if the numbers are not as high as before. Every person counts out there. We will not turn away anybody who wants a COVID vaccination.
Yeah, and I think that's important because, since you started this operation, it was not just Asian Americans stopping by. We have other people in the community who've heard about it, and saw that it was a free clinic. They can get their flu shots. They can get their first, second, now booster shots as well. And I know Dr. Christina Madison, she is the founder of the Public Health Pharmacist. You also teach here in town. I know you have volunteers from Roseman University have stepped in to help the clinic. As well. So talk to me about the importance of having ACDC as a resource here, Dr. Madison, in terms of giving not just these vaccinations, but also the information, right, coming from the people that hopefully the community trusts because of what they look like, the language they speak, and who they are.
Absolutely. So for me personally, I have a connection with the AAPI community and have been working with ACDC for many years. It started out with Hep B Free Las Vegas. If any of you guys remember, Hep B Free Las Vegas was an amazing outreach program that we provided to help the AAPI community find out their status and to get them vaccinated and get them tested, because a lot of people don't know that. So that was my first experience with the organization. And then that just kind of continued because I have so many students that I work with that are in the community. And so for me, it was a great opportunity to show them the benefits of community-based care because my focus is public health and prevention and chronic disease prevention, but then also giving them an opportunity to use their language skills. Because I do think that it's extremely important for patients to have that personal touch, and they're more likely to take those medical recommendations when we speak in language or we provide written information in language. So I do think that that's extremely important. And then just the benefits of my students and myself personally knowing what services are available in the community. So even if my students don't end up working in a clinic setting and they just end up working in a community pharmacy, they need to know what resources are available in the community to tell their patients about. So say you have somebody who either is underinsured or uninsured, knowing that there is this, new resource in the heart of, our Chinatown area, I think is an amazing resource, and is something that our students can promote. And then also just understanding and knowing the benefits of community-based care and doing outreach and pop-up clinics, I think is just, it's so beneficial. And I have had the honor and privilege of being involved, and I'm so excited for this to be a permanent resource for the community, and ultimately just making sure that we're providing not just equitable care, but the best possible care for this community.
Yeah, and Dr. Maria, and I know that you're still in the works and trying to get this clinic up and running, but talk to us a little bit about what you plan to offer and why it's so important, especially coming out of this pandemic and, just really seeing the needs that are out there, for people who are in minority communities or maybe low-income communities, and how they have been affected by this pandemic.
Well, of course, we will have the general medical services. That is something that we will definitely have. But we also want to include educational programs. We want to include community outreach. We want to include, in the future, pharmacy access for low cost to maybe even no cost pharmaceutical medication. We also want to include laboratory services, so you can get your blood drawn on site at any time at our clinic. Transportation, even providing healthy meals and cooking classes, so that people in our community will learn how to feed themselves healthy and nourishing meals. For the pandemic, I know that Dr. Julia can talk about how people have been affected in our community by the pandemic, and maybe what having a provider who is, part of our culture can do when it comes to taking direction and treatment in terms of having somebody who looks like you and speaks like you.
Yeah, and Julia, talk to that a little bit, because I know you said you speak Vietnamese fluently as well, right? As well as English. And I know, especially, maybe we touch specifically on the pandemic and booster shots. I was just reading, a new article this morning just talking about, maybe a lot of Americans have gotten their first or second, but when it comes to the booster shots, that message is still not getting through that it's important, especially as we're trying to kind of get through this latest phase. So what's kind of your take on that? What's kind of been the gist of why people are slow to do it, and how maybe ACDC with our vaccination clinics try to change that trend a little bit?
Yeah, I think the fact that a lot of minorities are kind of hesitant on the booster, I think it's a lot of it has to do with education and communication, like the lack of it. I know a lot of my Vietnamese people, they don't really know the importance behind getting the booster. They don't really understand that, you're even though you got 2 shots, your immunity can wane over time. There's not a lot of talks about that in the community, and there's a lot of misunderstanding and misinformation, a lot of false information. So I think it's very important, like Dr. Maria was mentioning earlier, the education program that we will have in the medical center in the future. That's going to be very important for the community. And also, yeah, I do see the disparity between minorities and their counterpart of the non-minority when it comes to COVID in the past couple years. So, for example, in the hospitals, if I have a patient who's of a minority that comes in with the same pathology as their counterpart non-minority, their disease presentation is always more severe. And I hypothesize it's because of their health in the baseline. Their comorbidity isn't being taken care of because they're not really relating to their doctors. The doctors aren't relating to them language-wise, cultural-wise. So it's hard for them to take care of their health baseline. So when they come into the hospital with COVID, they see usually it's more severe than their counterpart non-minorities. So yeah.
Yeah, that's really interesting. And that's why I think, the community health clinics, and especially, and as we're trying to push and get this open, this comes at a time, I think, more community clinics are at risk of closing, as I've been and seeing, just because of funding and just because of staff shortage. We've talked about that in not just at community health clinics, but large hospitals as well. And the burnout of nurses. We just had a recent episode talking about Filipino American nurses, especially, being burned out and quitting and just dealing with the stress of this pandemic. And I know, Dr. Madison, you've talked and you've been in this medical world for a long time, especially education. I think a part of this that we need to talk about too is making sure that people understand, medical professionals, especially new ones going into the field, that the reality of this new healthcare system is changing now, right? And the needs of patients are changing, and the needs from medical professionals, and the kind of stress and the kind of mental and physical toll that they have to be going through in the future.
Yeah, so I want to address two of those points. So one is the thought process that we actually need to have more, individuals of color going into the medical profession, right? So we need to address that as well. So if we're saying that we need more people that look and sound like us to help us to be able to make, those healthcare decisions, we also need to focus on the fact that we need more, of those individuals to go into the healthcare field. And then ultimately, that diversity side, we need to explain more within medical education. And so, talking about, ways that the healthcare system, unfortunately, is structurally biased against certain groups and certain minorities, talking about the fact that, that your zip code is the number one, portion of us that is going to determine how healthy or how unhealthy we are, right? So understanding those health disparities and inequities, I think, is extraordinarily important. And then ultimately, myself as a woman of color, making sure that I'm relating to other people within the BIPOC community and the Indigenous community, because I know that we may have different struggles, but the fact that we are minorities means that we may not be getting the best care that we should be getting. And so again, going back to those benefits of community-based health centers and making those positions for providers to go into that portion of the healthcare sector and making it more lucrative for them because of the benefits in our communities, and thinking about preventative care and wellness versus this reactive chronic disease management, because it really will save us a lot of money and a lot of healthcare dollars down the run. So I think it's a two-pronged approach, right? It's medical education, it's talking about diversity and inclusion, but it's also making sure that we're fostering more individuals of color going into this profession and making it something that they are attracted to, because we're actually paying them what they're worth.
Yeah. And it's great to see, especially with Dr. Madison, you've collaborated with ACDC and gotten, your students involved to volunteer. And Dr. Murray, what are we looking for? What are you needing right now in terms of community support to make this clinic a reality, of making it happen, obviously sooner than later, because the needs are out there right now, right?
Well, of course, the needs are out there. 80% of Asians, Pacific Islanders in the state of Nevada are underinsured or uninsured. So we have to address that situation with the medical center. One thing that I would like to point out, which is I think a concept many of us in the API community can understand, Eastern and Western medicine, they don't have to be opposing each other. They can actually work hand in hand. A very good example is my own mother. She has been a physician working in the United States for over 40 years. She is Chinese Filipino. So she does Western medicine, and she also adds in a little bit of Eastern medicine to her patients' treatments. So for example, she'll prescribe that antibiotic and tell you, okay, please fill your prescription at the neighborhood Walgreens or the neighborhood CVS. But she will also tell you, why don't you get a jar of Tiger Balm or why don't you get some Salon Pass?
Right.
For the non-Asian folks, Tiger Balm and Salon Pass are home remedies that have been relied on in the past for generations, maybe, I don't know, hundreds, if not maybe even thousands of years by Asian folk, not just here in the Americas, but also back in our home countries. So, Western and Eastern medicine, they don't have to fight. They can actually cooperate and help to heal our community by doing both. And that is something that we at Happy Medical Center want to encourage. We can provide Western treatment, but we also have the doctors and the nurse practitioners, the physician assistants who understand the value of keeping culture and keeping tradition alive. If you want to bring your Tiger Balm in your purse, but also, take that Zithromax or go to the hospital and get some Western medicine, do both as long as you get better.
Yeah, and it's those kind of like personal stories, like, knowing the backgrounds and kind of the knowing that there's such a range in terms of Asian American cultural background. So we come from so many different places, but we have that kind of universal story that connects us as well. And Dr. Julia, I'm interested because we met, we haven't actually met in person, but knowing your background, talk to me. Do you have any kind of personal stories that kind of really motivated you to say, hey, this is really important to have someone like me, people who look like us, be in the health field? Have you had like a personal story that really touched you?
Yeah, actually, what Dr. Maria was talking about, I want to touch on that. When I was doing my pediatrics rotation at the hospital, there was a case where the doctor was actually filing, calling CPS for child abuse. And it turns out that this little kid had bruises on his back. It wasn't from abuse. It's from something called coining. So for people who don't know what coining is in the Asian culture, especially Vietnamese, I think the Chinese do it too. But what we do is we use this essential oil. It's called yao yao. It's kind of like Vicks vapor rub. And they would use either a coin or a spoon to kind of rub on your back with that essential oil to make these lines to help I guess the bad air leave your body so that you can recover from like a cold or flu. But like the aftermath of that is just crazy because it's like these bruises and it can look like you're being abused by your parents.
Yeah.
So I thought that was really interesting that, CPS was called. It wasn't it was just the parents were doing something culturally to help the son. But it was being misunderstood because the provider didn't understand the culture and, stuff like that. So I just think it's really important for patients to have doctors and providers who look like them, who understand their language, who understand their culture, because in the end, you tend to put more trust in that provider if they understand you at like a deeper level, like language-wise, cultural-wise. And when you trust your provider, your providers, then can tell you what to do, and you're more willing to like listen and do what they tell you to do.
Yeah, and you're talking about that just one case, but that could essentially turn off that family to maybe go to their doctors and get help, in the future, or, become, you said mistrust that starts because of something like that. So, yeah, it's so important. I think it's great that ACDC has launched, at least the start of this in terms of the vaccination clinics. Of course, you have the food distribution events that go hand in hand with that in terms of educating people about good nutrition and giving them the food when they need it in times of the pandemic. And Dr. Madison, just to start kind of wrap up this conversation, I know you've been part of this, community for a while now, coming from your background. What kind of parting thoughts do you have for our community, just minority community, BIPOC community moving forward? Are we kind of at the light of the end of the tunnel now when it comes to this pandemic? And what do you think are the biggest things that we need to kind of think about and change, especially when it comes to getting people to really take care of themselves and each other in this sphere of public health?
I will say this. Ultimately, I think that the pandemic fatigue has has fully set in. And as a parent of, two small children, one who was able to get vaccinated and one that is not, I definitely am hopeful that there is light at the end of the tunnel. But ultimately, as much as we want to be done with this virus is not done with us. And so I think my parting words is that we will likely not ever completely eliminate COVID-19, but that we have to learn how to live with COVID-19. And I think that is completely possible, but we need to make sure that all of the mitigation techniques that we've been using are employed. We have all of the tools to get out of this pandemic. We just haven't been able to successfully use all of them because there are some people that are very resistant because of the fact that we've used things like mandates. And so I think people are much more likely to do something if we don't tell them that they have to do it. And we give them that sense of free will. But I also think that we needed to really emphasize the benefits, not only on the individual, but also for the community at large. And so, especially when you have cultures like minority cultures, we understand the benefit of doing things for the family and doing things for our community. But I think, again, the unvaccinated, unfortunately, are causing the pandemic to continue. And so, meeting people where they are, finding out what their why is, making it as easy as possible for them to get vaccinated. I think that's going to be what we need moving forward. Also utilizing testing more appropriately, and then well-fitted masks. This new variant is probably not going to be the last. Omicron was extremely infectious and contagious. And so we need to upgrade, those cloth masks are no longer valid anymore. We need to use a KN95 or an N95. And that's, really what we need moving forward. So we need to upgrade ventilation systems. We need to use all of the federal funding that's currently available for pandemic preparedness and for public health workforce, and utilizing things like community health workers and having community health workers that look and sound like the population that's in most need. Yeah. And just remember, that we are here to help you. Government is not, something that is an enemy, that, as much as we probably have bungled the communication piece. There are lots of resources out there. So if you haven't gotten your 2 free home COVID tests yet, please make sure you order those from the federal government at covidtest.gov. And then, make sure that you are, getting those masks, because you can now get N95s for adults at community health centers and your local pharmacy. There's a list, I believe, that was just posted by UNLV School of Medicine for where those free masks are now available. And ultimately, it's going to take all of us together to get through this pandemic. And just, don't just think about yourself, think about your family, think about your community and what you would want for them. And then, do the right thing.
Awesome. Well, thank you so much, Dr. Madison, for joining us in this conversation. And also Dr. Julia Oberndorf, welcome to ACDC. It's great to see you, and thank you for being a part of our growing and diverse staff at ACDC. So it's great to see you. And Dr. Maria, I know you've been a very busy woman. And also, we want to let people know our vaccination clinics are ongoing, and now we're doing it pretty consistently, right? Oh, and make sure your mic is on for me too.
There we go. That's right, Petrania. Starting March, our vaccine clinics will be at Shanghai Plaza every first and third Saturday from 10 a.m. to 2 p.m. And they will keep going on like that until we have our wonderful Happy Medical Center open and operational. One last parting thought from me, Dr. Julia, and everybody at ACDC. We want everybody to know that ACDC and Happy Medical Center, we are fully committed to giving back to the community that relies on us, and that we want to meet our community's growing healthcare needs. So please, continue to support us as we continue to support you.
Awesome. Well, thank you so much, Dr. Maria Urbis-Tondo with ACDC, along with Dr. Julie Oberndorf and Dr. Christina Madison, all part of this great conversation we're having today. Stay safe and well, and we'll see you next week on Family in Focus.